Greetings to everyone watching. I am a student of Lakhimpur College of Veterinary Science, North Lakhimpur, Assam, India. The topic I am discussing about is Swine Erysipelas. Erysipelas in swine is caused primarily by Erysipelotrix rhusiopathy, a bacteria carried by up to 50% of pigs. It is also known as the diamond skin disease. It is an infectious disease characterized by diamond-shaped skin lesions in acute form and non-suppurative arthritis and vegetative endocarditis in chronic form. The epidemiology. There are 22 serotypes of Erysipelotrix rhusiopathy. It is a zoonotic disease which occurs throughout the world. Pigs of all ages are susceptible, but adults and sucklings are more susceptible. Now let us move on to the transmission. The organism resides in the tonsillar tissue. These carriers can shed the organisms in their feces or oronasal secretions, through contaminated feed or water, through skin abrasions. We, the veterinarians, can get infected while handling the virulent vaccines used for vaccinations. Let us move on to the clinical findings of swine erysipelas. There are three forms of this disease, that is, acute, subacute, and chronic form. In acute form, there is rise in temperature, anorexia, ocular discharge, sudden and unexpected death, febrile episodes, inappetence, and painful joints. The incubation period is 1 to 7 days. The skin lesions vary from generalized cyanosis to rhomboid urticaria lesions. It mostly affects growing and finishing pigs. In subacute form, the lesions are milder than the acute form. The chronic form is characterized by enlarged joints and lameness, alopecia, dyspnea, cyanosis, and death. Vegetative valvular endocarditis is the second form of chronic erysipelas. It is most common in mature or young adult pigs. Let us now discuss about the diagnosis. The diagnosis can be done based on the clinical signs such as presence of skin lesions and lameness. Secondly, isolation and identification of Erysipelotrix rhusiopathy from the blood of affected pigs in acute cases helps to establish a diagnosis. Thirdly, we can use ELISA and agglutination tests, which are also available. Lastly, serological tests are also done for the diagnosis. Differential diagnosis can be made against Septicemia salmonellosis, classical swine fever, and endocarditis. Now, for the treatment of this organism, it can be emphasized by vaccination or antibiotics. These are sensitive to penicillin, which can be given at the rate of 50,000 IU per kg body weight intramuscularly for 3 days. It is known as the drug of choice for swine erysipelas. Other antibiotics such as ampicillin and ceftiofur also yield satisfactory results in acute cases. Cortisone can be given for pigs having arthritis at the rate of 75 mg subcutaneously. Tetracyclines given in feed and water is also useful. For the prevention and control of swine erysipelas, early treatment with appropriate antibiotics, particularly penicillin, generally leads to recovery. Good hygienic measures should be followed in the farm. Injectable bacterines and attenuated live vaccines delivered via water are available and provided extended duration of immunity. Susceptible pigs should be vaccinated before weaning, at weaning, and several weeks after weaning. The male and female pigs selected for breeding should be vaccinated with a booster 3 to 5 weeks later. Thank you.